You are listening to part 37 of our series, 7 Medicines, The Wise Woman Way with Susan Weed at Time Monk Radio. Hello, Susan, and welcome back to Time Monk Radio.
Hi, Gemini. It's so wonderful to be here with you again, and especially to be continuing our ongoing series about the 7 medicines. I often say that during my life I've had 3 good ideas: drink nourishing herbal infusions, there are 3 traditions of healing, and use the 7 medicines. So this is, of those topics, the one that I have written the least about in terms of writing about it, but spoken the most about, and it forms the basis of all of my books except my green book. The idea of taking an orderly and ordered approach to what we're going to use to heal ourselves, starting with serenity medicine, moving on to story medicine, mind medicine, lifestyle medicine, and then the great divide that separates those 4 first medicines that always improve our health, from the last 3 medicines that always erode our health: alternative medicine, pharmaceutical medicine, and high-tech medicine. And we've just spent quite some time looking at alternative medicines, in fact, and we are now ready to turn our attention to the 6th medicine, pharmaceutical medicine. Use drugs. In a way, drugs are herbs. I often say that there's an arc of herbalism that runs historically from naked people rolling in the plants to a white-coated lab technician making a drug from a compound found in a plant. I read that still more than 80% of the drugs that are used are directly derived from plants. But most of us make a distinction between drugs and herbal medicine. Exactly where that distinction is can be quite individual. Here's how I define a drug. A drug is something that doesn't grow from the earth and can't be made in your own kitchen. So what that means is that marijuana and even opium aren't drugs, according to my definition. Marijuana because it grows from the earth, and opium because it's the juice from a plant that grows from the earth, and you can turn that juice into opium in your own kitchen. However, essential oils and vitamin and mineral supplements would fall on the drug side of the line because they do not grow from the earth and they cannot be made in your own kitchen. As I said, in a way, this is an individual thing where it is that you draw the line, and certainly both nations and states have different ideas about what might or might not be a drug. To further confuse the issue, there are drugs that we would recognize as drugs that you can get without a prescription, as well as drugs that you have to have a prescription for. So we can't say, oh, a drug is a substance that is controlled, or even a drug is a substance that is dangerous. We can, however, say that in order to be sold as a drug in the United States and in most what's called Western countries, a drug must pass a test called LD50. And LD50 means lethal dose 50%. So the drug must be given to animals in ever greater concentrations until 50% of the animals die. And the amount of drug that causes 50% of the animals to die is the LD50, and this then allows that to be sold as a drug. One of the things that has most amused me herbally was a statement in the first edition of The Honest Herbal by Vero Tyler that he hadn't planned to include chickweed in his herbal because it was basically a useless herb. But unscrupulous herbalists, and I believe he was talking about me because my book with an entire chapter on chickweed had been published that year, unscrupulous herbalists would have one believe that chickweed was a medicinal plant, and he could prove that it was not a medicinal plant because it had never killed anyone. So we have this idea that drugs can make us healthy, and yet that idea is completely unsubstantiated. It is rare that a drug makes us healthy. Now, it is quite common that a drug can keep us from dying. Insulin, we might call a drug that keeps us from dying. Thyroid medication, for those who need it, is a drug that probably keeps them from having symptoms that they certainly don't want to have. Anti-rejection drugs taken by people who have had organ transplants are certainly drugs on which the person's life depends, and yet even in those situations, we would not say that the drugs are making us healthy. So we make a distinction between, once again, the first four medicines, including lifestyle medicine, which can include our nourishing herbal infusions, and those always make us healthy. And then the last three medicines, alternative medicine, which includes herbal medicine, pharmaceutical medicine, and high-tech medicine, which always erode our health. So frequently when I'm talking about the 7 medicines, I say to my students, I just don't have that much to say about drugs. But for this series for Time Radio, I want to have a lot to say about drugs. And I want to have a lot to say about drugs because I want us, because we're studying and working on this together, to have a sense of what we do or what we can do if we or someone we love is taking drugs and we don't want to be taking those drugs. And as we remember, way back in the beginning, we talked about how we can work our way through these 7 medicines, starting with Serenity Medicine, and if that doesn't work, going on to Story Medicine. And we also talked about when we got to the level where we were having relief from our pain, our problems, whatever it was that had brought us to work to solve that problem, that if we had gone over the Great Divide, if we had used anything besides Serenity Medicine, Story Medicine, Mind Medicine, and Lifestyle Medicine, that we wanted to go back. So if we're in pharmaceutical medicine, we go back to herbal medicine. And then from herbal medicine, we go back to lifestyle medicine. And this way, we are always using things that promote health and make us healthier instead of being locked in a cycle of using things that make us less and less healthy. I often think about my friend Edith, who had hot flashes so severe that they were literally knocking her out. She became very reclusive, and after several months of this, she decided she was being silly. And so she went to her doctor, and she asked if the doctor had anything that could relieve her hot flashes, and the doctor, of course, prescribed hormones for her. And she took the hormones for a month, and she went back to her doctor, and she said, well, I'm enjoying taking the hormones, but I'm so bloated. And the doctor said, well, yes, that does happen to a significant number of women, so here's a diuretic, and that will take care of the bloating. And she came back at the end of that month, and she said, well, things were definitely better. She was still not having terrible hot flashes. The hormones seemed to be working, and the diuretic was working, but she was having other symptoms, and the doctor said, those symptoms are from lack of potassium because the diuretic is leaching potassium from your body. So here is a script. You don't have to get it at the drugstore, but you need to get a potassium supplement. So now she's taking 3 pills. And she came back at the end of that month and complaining of being constipated. He said a potassium supplement can do that. Here's something to help that. And at this point is when I met Edith, because she said she could see where this was going. She kept getting a prescription to counter the side effects of the previous prescription. And this is not an unusual tale. This is, in fact, a very usual tale in the United States, Canada, and westernized countries where people are given drugs. So we were able to find some herbs, specifically motherwort for Edith, that became her very powerful ally so that she could move away from taking those drugs. So as we move into working with the sixth medicine, working with pharmaceutical medicine over the next few months, we are going to be looking at specific problems, the drugs that treat those specific problems, and then the herbs that we can use instead of those drugs. In my books, people often assume that my books just talk about herbs, but in my books, I also take this approach. I want people to know if they have a problem, what drugs are prescribed for that problem, and what the side effects or problems might be with taking or using that drug. Of course, that's right there with the information about herbal medicine, lifestyle medicine, mind medicine, story medicine, and serenity medicine, as well as high-tech medicine, any surgery or diagnostic tests that might be used in seeking help for any particular condition. I was really interested to see that a former Google engineer and a past executive editor of Wired teamed up to serve up a dish on the pharma industry. The site is called iodine.com. iodine, iodine.com. It's a free site that provides important information about drugs, how much, such as how most users rate it, the likelihood of experiencing various side effects, and the way that a drug can affect your current condition, all in simple language. If some of the other medical sites that you visit are kind of jargony, there is a Google Chrome extension that is a translator. You can hover over the word that you don't understand, like epistaxis, and you get the translation into plain English, nosebleed. That's iodine.com. I also subscribe to a newsletter that I really rely on to give me the lowdown on what's happening with drugs. And that periodical, Worst Pills, Best Pills News, is available from www.worstpills.org. Rely on us for life-saving information on the drugs you take. And this issue, which is the current issue, they're looking at a drug that's being given to patients who have blood clots or at risk for strokes, and they have a very big box, do not use for 7 years. And they have a 7-year rule. Avoid the use of any new drug for the first 7 years after it is approved, unless it is a rare breakthrough drug that offers a documented therapeutic advantage over older proven drugs. The 7-year rule was created for these reasons. New drugs are the most dangerous drugs. We know the least about their safety. Serious side effects are life-threatening drug interactions with other drugs probably won't be detected until the new drug has been on the market for many years and taken by hundreds of thousands of people. Remember that a number of new drugs have been withdrawn from the market, or serious adverse reaction warnings have been added to their labeling, usually within the first 7 years after they have been approved by the Food and Drug Administration. It used to be that it took a very long time for the Food and Drug Administration to approve a drug, and especially with research into drugs to help people who were HIV positive, the rules got loosened up so that drugs could be moved more quickly through the pipeline and into people's hands. And that has allowed some pretty dangerous drugs to go on the market. The editorial here from the editor is the new FDA commissioner is unfit for duty. We then have treatment for nasal allergies, an updated review, the common types of treatments, and the specific drugs that are the most dangerous to use, and an article on the best drug for severe acute low back pain, and fluoroquinolones are linked to life-threatening complications. This is an antibiotic, fluoroquinolone, and fluoroquinolones are widely used and often unnecessarily. They are effective in treating serious bacterial infections such as pneumonia and kidney infections, especially in people at high risk of complications. However, they are not first choice drugs, and they are definitely being overused for urinary tract infections. They damage collagen, the building block of many of the body's tissue. And about 10 years ago, in response to hundreds of reports of tendon rupture and tendinitis occurring in people on fluoroquinolones, we successfully petitioned the FDA for a prominent warning on this. So this is an organization that is actively involved in helping to protect us and to protect us from the kinds of things that we could easily be led into. You know, another thing, of course, that is difficult for many people is that it has become allowable to advertise drugs. And so we get subliminal messages and a lot of push to take drugs, to ask for drugs that are going to be harmful for us without our really having an understanding of that. I also really like the little list that they publish once a year of the 20 pills you should never take, and they include things like Crestor, Celebrex, Lunesta, drugs, Valium, drugs you know. When to say no to a prescription? Well, of course, if you listen to Susan, just say no to prescriptions all the time. The herbs are going to do it better. But this article by an MD, I found very, very helpful. And it's from a November 2015 Reader's Digest. And he suggests that we say no to antibiotics for ear infections. Most ear infections improve without drugs. You might want to say yes if your baby is younger than 6 months or if the child is in extreme pain. Say no to antibiotics for eczema because antibiotics generally don't relieve most skin conditions. You could say yes if your skin is covered with sores full of pus, ooh, or you're running a fever. Say no to drugs for eye infections. Doctors often prescribe prophylactic antibiotic eye drops after treating eye diseases, but antibiotic drops are rarely needed. I was just celebrating a friend's 70th birthday, and she was saying that her cataracts were interfering with her ability to really enjoy life, but she didn't think that she could have cataract surgery because the doctor that she had consultant said that in order to have cataract surgery, she would have to use antibiotic drops in her eyes, and she's very reactive to antibiotics. And I said to her, the person who told you this is misinformed. Yes, that is actually standard operating procedure. You tell people they need to use antibiotic eye drops, but in fact, the experiences of a great many who have allowed people not to use them are that it works just fine unless there is swelling, redness, heat, or pus in your eye after any procedure. Say no to antibiotics for respiratory infections, coughs, colds, flus, even bronchitis is not going to be helped by taking antibiotics. The only time that an antibiotic would help is if there actually is strep throat, and it's actually not that common. Say no to antibiotics for sinus infections. Sinusitis is usually viral, and taking antibiotics is not going to help. Say no to antibiotics for urinary tract infections. Older patients, especially those who live in long-term care facilities, are often given antibiotics when a routine physical finds bacteria in their urine, but most of these patients don't actually have symptoms and don't need an antibiotic at all. As we will see as we begin to talk about antibiotics, there is a growing problem with antibiotic-resistant bacteria. In fact, last year, 23,000 people were killed by bacteria resistant to all known antibiotics, and another 2 million people became seriously ill because of antibiotic-resistant infections. Tens of millions of Americans now take drugs to lower their cholesterol, lower their blood pressure, or lower their blood sugar. Dean Ornish, in an article in Time magazine, March 2015, says, when a patient asks, how long do I have to take these drugs to lower my cholesterol, lower my blood pressure, reduce my blood sugar, the answer is forever. This is what I mean by erode our health. When we're taking something that improves our health, we don't have to take it forever. The costs, both human and financial, of drugs are well documented. Randomized, controlled trials have shown that stents and angioplasties do not prolong life or prevent heart attacks in most stable heart patients. Only a small percentage of men treated for early-stage prostate cancer benefit. Type 2 diabetes and prediabetes affect almost half of Americans over the age of 20, and yet drug treatments to lower blood sugar do not prevent the complications or the onset of diabetes, as well as lifestyle changes. About 86% of the $3 trillion we spend every year on health care in the United States is on drugs to treat this kind of chronic disease. We can choose the kind of medicine, not about how long we're living, but about how well we're living. When you change the mechanisms of health, you will be surprised at how much better you feel and how quickly. I don't want you to make changes, says Dean Ornish, because you're afraid of dying. I want you to make changes because you're happy to be alive. This is what we're talking about. Not that anybody is demonizing drugs or saying that drugs aren't useful, but we're saying that there are better choices than drugs. So let's see what the problems are with some of those drugs and what we can use instead. There's one more thing we need to think about when it comes to drugs, and that is that women are different than men. I know this should be something that goes without saying, but did you know that women wake up from anesthesia faster and are 3 times as likely to wake up during surgery? Biological variation leads to dangerous drugs. Gender differences are understudied, and even when information comes to light, it rarely makes it to the average doctor's office. This is an article by Linda Marsa from More magazine in February 2015. The over-reliance on male animals and unidentified cells in preclinical research obscures key sex differences that could help guide us. For instance, research using female rodents has suggested that estrogen could play a role in protecting women against multiple sclerosis. Right now, the vast majority of drugs on the market have never actually been tested on women. This shocked the pants off me when I was researching for my book, Breast Cancer, Breast Health, at how many times drugs that were used to treat breast cancer had never been tested on women, only on men. The idea behind this is that it's unethical to test on women, since after all, they might be pregnant and not know it. Until 1993, women of childbearing age were routinely excluded from trials of new drugs. And so all drugs were tested exclusively on men, and any effects that happened to women that didn't happen to men weren't knowable until after the drugs were already on the market. But women experience a disproportionate share of adverse side effects and reactions that are severe. 8 of the 10 drugs pulled from the market between 1997 and 2000 were more dangerous for women than men. Poscor, a hypertension treatment, can slow down and stop the heart from beating in some women, and the diabetes drug Regulin causes severe damage in some women who take it. The FDA is starting to issue sex-specific guidelines. For instance, they have halved the recommended dose of the sleep aid Ambien. They find that women metabolize drugs more slowly. Drugs linger in the systems of women longer, and when it comes to sleeping pills, that puts women at risk for overdose and next-day drowsiness. Between 2009 and 2011, women accounted for 68% of emergency room visits due to overdoses of Ambien. It's not just that. Women process a big group of medications differently, and these discrepancies can lead to dangerous consequences. In fact, women's body chemistry is distinctly different from men. Numerous studies find that the liver enzyme CYP3A4, which is responsible for metabolizing more than half of all prescription drugs, is more active in women. Muscle-to-fat ratio is a factor as well. Some medications, such as tranquilizers like Valium and Xanax, are attracted to fatty tissue, and there's more of it in a woman than a man, so these drugs stay in a woman's body longer, causing more side effects. The newer and more widely used SSRI antidepressants are probably more effective in women, while men probably do better with older class of depression medications known as tricyclics. Some drugs place women at significantly higher risk of developing potentially fatal irregular heartbeats. The antihistamine Seldane and the heartburn pill Propulsid were, in fact, removed from the market because of their danger to women. Many medications, however, that still do this are still being sold. For instance, Zoloft, Prozac, Haldol, Thorazine, and lithium. Women are not simply small men. Women's arteries, women's blood vessels, women's nervous system are all different than men, and the drugs we use and the dosages that are used in women cannot be the same as those used in men. So for women, and of course you know my special interest in health is women, for women, drugs become especially problematic and especially dangerous. We're going to look really closely at antibiotics, problems with antibiotics, and some herbs that we can use instead of antibiotics next week.
That sounds wonderful, Susan.
Green blessings, everybody. Thanks so much for having me on the show, Gemini.
Thank you, Susan. And this concludes part 37 of our series, The 7 Medicines, The Wise Woman Way with Susan Weed at Time Monk Radio.